dean pulled me aside and said, have you ever thought about podiatry? Let me get you set up with a podiatrist so you can shadow. And they took me to the operating room. I got to shadow them in the office, and literally after that first week, I was hooked. I just love with podiatry, you get to do a little bit of everything, surgery, medicine. You're kind of the first line and, fighting vascular disease and what have you. And a lot of the stuff that we do, like patients are going home with like instant gratification. So that's what got me into podiatry. And so right when I was starting the practice, I met with a dear friend, and she's kind of become a mentor, Carol Stokes, who owns Bay Meadows MRI. And so she set up a lunch with, the two of us, and we just had a brainstorming session on how to promote the practice. And at the end of that session, I said, I really want to get involved. And I said, I don't just want to write a check or just do something once a year. I really want to get my hands dirty. Do you know of anything? Because I don't know of something local. And so she immediately said WeCare. So she set up a lunch, and that's where I met Dr. Sue Nussbaum. And the moment I met her, I just fell in love with her. And I'm like, I don't care what WeCare is. I just want to do whatever she's doing. And I just really grew to respect her. She, whatever she says, she actually does it, lives it. And, of course, during that meeting, she gave me more information about how WeCare started, what it stands for, and if I really wanted to be involved, what would be expected of me. My grandfather, he was a minister on Sundays, but Monday through Friday he was a dentist and did oral surgery. And so he just kind of instilled in that, any of us that wanted to go into medicine, he's like, always give back. And so, there's a lot of different organizations, but I personally wanted something that was local, that was specific to Jacksonville. And I just thought it'd be great to, just be able to do surgery for someone that otherwise, couldn't have surgery on something that, could cause them constant chronic pain. So that was really important to me. There's one that will always stay with me, and his mother actually will from time to time send me a message. And after we did surgery with him, he actually drew me a really nice piece of art that we keep up in the office in like the little hall over there. But he had been living with a chronic bunion pain for years. And again, nothing serious or life-threatening, but for him it was something really serious because, it affected the way he walked. He could hardly wear shoes. And he just kind of learned to live with it and just thought that there was nothing he could do about it. And this was a awesome family, hardworking, but because of certain circumstances, this gentleman didn't have health insurance. And I think he'd been living with it for almost 10 years. So WeCare, asked if we could take him in. We said, of course. And, we had the first visit, and I immediately just fell in love with him and his family. And we, I think, had the following visit to do our pre-op consultation. And so we did the procedure at a local, outpatient surgical hospital here. And, I went to the recovery room to check on him and his family. And his mother was just so appreciative. She started crying and, just thanked me. And we continued to follow up with him for about a few months just to make sure he was recovering, just the way I would any other patient. And even though I helped him, I gained more from the experience, and I think that's the wonderful thing with WeCare. Patients are coming to you to help them, but I think us as volunteers, we get a lot more out of it. And you see a lot of yourself in these patients, and you realize that just like that could be you. So it's very humbling, and it just makes you feel so small, and you just realize that just this one little act of kindness is really making a big difference in these patients' lives. So yeah, he's like probably my number one. I always remember him. Yeah. No matter how busy you are, if you have it in your heart to want to help someone, definitely consider, volunteering with WeCare. We have a very busy practice, but, they're just like any other patient that's on your schedule. So if you are a physician here in Jacksonville, no matter how busy, don't let that be an excuse. Just consider joining, and, just whether you're an oncologist, a podiatrist, what have you, especially if you are a surgeon, because I think that's the biggest need. A lot of these patients have issues that, aren't necessarily life-threatening, but they are causing them chronic pain. And so if you can just take out maybe 2 hours in your day of your surgical schedule to provide free care, it really will just enrich your life and change it for the better.